This is my statement.
Cunningham says last month her Affordable Care Act health insurance premium was around $35, but this month it's nearly $113, more than triple the cost.
I'm a business owner, so I don't have a boss to help me pay for my health insurance. I pay for it. So it's been hard.
That's the reality of what is happening. That is Sarah, who owns her own business and works really hard to make $55,000 a year, and her health insurance just went from $36 to $113 in 1 month. Republicans had until December 31st to keep healthcare affordable, and they just couldn't be bothered to do it. And now premiums have doubled for millions of Americans, and Sarah was hit even harder. And look, if I hear Republicans say one more time that this will only impact Obamacare, because that's not how this works. When millions of people drop their coverage because they can't afford it, costs rise for everyone. It doesn't matter if you get your insurance through your work or Medicare or wherever, your costs are going up too. I mean, not for nothing, I spent 15 years in the health insurance industry, and I am telling you, when there are fewer people in the pool, those that are left have to pay more. And you know what else? It is terrifying that in the richest country in the world, nearly 40% of Americans are already delaying care, skipping appointments, having to borrow money to pay their medical bills. And Republicans just made it worse. But hey, not all hope is lost. Stay with me. The House has already passed a 3-year extension. They passed that on January 8th. The vote was 230 to 196 because even 17 Republicans voted with them because they know what a disaster this all is. But now it's in the Senate, and they are stalling because apparently we can afford tax breaks for billionaires, bombs, the deportation machine, but healthcare for 12 million small business owners, farmers, self-employed people who are the backbone of our American economy, that we have no money for. This was a choice. They knew exactly what they were doing, and we need to make sure they know that we see that. So call your senator. Call 1-833-312-1833. Tell them to pass the House bill, not a watered-down version, the bill that has already passed. That number again is 1-833-312-1833. Make that call.
First things first, as Mandy said, please go call that number and ask your senator to pass the House bill. But what you're experiencing in that video is happening across the country. So, for example, when Renee lost her job and we had very minimal income coming in, we got on an ACA plan, and we were paying like $963 a month, and the federal government was chipping in $533. So after they chipped in $533, we paid $963. And now we've reached the point where the income doesn't qualify for a subsidy. But had we continued to need that subsidy, we would have been looking at that minimum increase of the $533 a month for our plan. But in reality, it would have been more because we still have the same damn plan. And because we are business owners and because we don't have an employer picking up a part of the tab, we're now paying $1,800 a month. $1,800 a month for the insurance, $100 a month if I got to go see a specialist, still paying for medication. We have a big out-of-pocket. We have a $9,000 deductible, I think $20,000 out-of-pocket. It's insane how much of our income has to be committed to healthcare. It's absolutely crazy.